PreventionLink is an innovative disability prevention program that focuses on the link between the primary and secondary prevention of occupational injury, illness, and disease in workplaces throughout Ontario. The program offers training, mentoring, outreach, and advisory services for unionized and non-unionized workers, workplace representatives, and employers. Welcome to PreventionLink's presentation. PreventionLink has put together this presentation on workers' compensation and COVID-19. It will focus on reporting an injury or illness to the Workplace Safety and Insurance Board of Ontario. It includes some information specific to Commonwealth, Caribbean, and Mexican seasonal agricultural workers. When an injury or illness happens on the job, the Workplace Safety and Insurance Board, also referred to as WSIB, provides compensation such as wage loss benefits, medical coverage, and support to help workers recover and get back to work. If you have been diagnosed with COVID-19 and believe you may have contracted this virus in the course of your employment, you must take the following steps to claim for WSIB. Step 1, seek medical attention. Step 2, report to your employer. Step 3, file with the WSIB. And Step 4, work together. Step 1, seek medical attention. You must get first aid right away. If you need further treatment beyond first aid, go to a health professional. Your employer pays for your transportation on the day of injury, if needed, to a hospital or physician located within reasonable distance of your home. First aid does not need to be reported to WSIB. Be sure to keep a record if you do receive first aid. Step 2, report to your employer. Tell your employer about the injury or illness and medical treatment. They will need to report to WSIB. In addition, the employer must investigate and keep a record including the steps taken to correct the issue. Step 3, file with WSIB. Report to WSIB if you had treatment from a health professional beyond first aid, or you can't work, or you are being paid less or working fewer hours. Your employer must report a workplace injury within 3 days of learning about the injury. Your employer must give you a copy of the report, known as the Form 7. Step 4, work together. Stay in touch with your employer, stay in touch with WSIB, and stay in touch with your union if you belong to one. There are 3 forms used to report an injury or illness to the WSIB. The Form 6 is the worker's report, also known as the worker's story. After completion, a copy must be given to the WSIB and the employer. The Form 7 is the employer's report. After completion, a copy must be given to the WSIB and the worker. The Form 8 is the health professional's report. After completion, a copy of the form must be sent to the WSIB, and a copy of page 2 must be given to the worker. This page contains information about the worker's functional abilities. It is the worker's responsibility to share page 2 with the employer. It's a good idea to share all of these forms with the union where one exists. You must report your injury to the WSIB as soon as possible and no later than 6 months after it happens. For an occupational disease, within 6 months of learning of the disease. The 6-month time limit for injured or ill people to file a claim for benefits will not apply while the state of emergency is in effect. Just a reminder, a copy of the Form 6 should be given to the employer after completion. The employer must report the injury to the WSIB within 3 days of learning about the worker's injury or illness. If a business can't meet expected timelines during a state of emergency, the WSIB will use their discretion on a case-by-case basis to avoid unfairly penalizing businesses. The employer must provide a copy of the Form 7 to the worker after completion. The treating health professional must give a copy of page 2 only of the Form 8 to the patient to give to their employer. Reminder that page 2 only contains functional abilities information. Both pages 1 and 2 must be sent to the WSIB. In these unprecedented times, the WSIB supports virtual care for the delivery of programs and services. Reporting in COVID-19. File a claim with WSIB if you contracted COVID-19 while at work and you have a diagnosis or symptoms. Do not file a claim if you believe you were exposed to COVID-19 while at work, but you were not ill at this time or have a confirmed positive COVID-19 result. If you believe you were exposed to COVID-19 while at work, but you are not ill at this time, you can file one of these forms: an exposure incident form or a construction exposure incident form. The purpose of this form is to obtain information about the exposure incident experienced by the worker should an illness or disease occur in the future. These forms can be found on the WSIB's website. 2 frequently asked questions when reporting COVID-19 to WSIB. Can my employer discourage me from reporting to WSIB? The answer is no. It's against the law. Does WSIB cover a quarantine period? No. There is no coverage from WSIB even if you are sent home. There are many ways to submit forms to WSIB. They can be mailed to 200 Front Street West, Toronto, Ontario, M5V 3J1, uploaded by computer to wsib.ca/en/upload. They can be faxed 416-344-4684 or 1-888-313-7373. And if you have any questions, you can call them at 416-344-1000 or toll free at 1-800-387-0750. For a COVID-19 claim to be allowed, evidence must show that the person's risk of contracting the disease through their employment is greater than the risk to which the public at large is exposed, and that the work significantly contributed to the person's illness. The next 4 slides are specific to Commonwealth, Caribbean, and Mexican seasonal agricultural workers. While in Ontario, you are covered when coming from the airport in Ontario to your employer's business and using a bus or car with your employer's authorization when traveling to and from your employer's business on a direct, uninterrupted route, and taking time off or during mealtime while on your employer's properties, and sleeping in the accommodation your employer provides. You are generally not covered when taking part in recreational activities away from your employer's locations or visiting with family and friends. You do not need an OHIP number to be tested for COVID-19. If the WSIB allows your claim, you will receive loss of earnings benefits and other benefits as necessary while you are recovering and until you are able to return to work. It is your employer's responsibility to provide accommodation for you while you are recovering. Some workers may not be able to access quality care in their home country. The WSIB determines if somebody should stay in Ontario during their recovery. For more information on COVID-19, refer to Public Health Ontario, Public Health Agency of Canada, your local public health unit, the Ontario Ministry of Health. Pandemic circumstances are ever changing. Please review the WSIB's website for the most up-to-date information at wsib.ca. PreventionLink provides training on a range of topics beneficial to all parties in the workplace and essential to workers' compensation and disability accommodation. Please check our website at PreventionLink.ca. Thank you for joining us.